January is Cervical Cancer Awareness Month, and it's a cancer that shows just how important testing and research are. Denver 7's Katie LaSalle has more.
Dr. Jeff James, a gynecologic oncologist at Skyridge Medical Center, joins us now. Dr. James, thank you so much for taking the time to speak about awareness today.
Yeah, thank you so much for having me. Appreciate the opportunity.
Of course. So cervical cancer, it was once one of the most common causes of death for American women, but the death rate has dropped really significantly thanks to pap smears. Can you tell us more about screening for cervical cancer and why it's so important?
Yeah, absolutely. Thankfully, to your point, cervical cancer in the United States is relatively uncommon. We only have about 12,000 cervical cancers that are diagnosed a year, and that has all been driven by pap smears in the past. And hopefully those numbers will go even lower as we have the HPV vaccine now available to us. But worldwide, it's still relatively common, particularly in underdeveloped countries that don't have pap smears available. But pap smears are the primary identifier of pre-cancers before they become cancer. And that's how we're able to monitor and take care of them before they turn into an invasive cancer.
And you mentioned the HPV vaccine. Who is eligible for this vaccine and how does it work?
Yeah, all women and even boys now, typically between the ages of 9 and 11, but as young as 9 and up to the age of 45 are available or candidates for the vaccination. It's typically 2 shots. My understanding is vaccines have become quite the hot topic in the United States. We now know that they're available at Walgreens, CVS, your primary care provider. If you contact any of those places, they typically will be able to tell you whether you're a candidate for them or not, and be able to arrange for injection.
Are there signs and symptoms that women should be aware of cervical cancer?
Definitely. So irregular periods, post-coital or after intercourse, bleeding, definitely watery discharge that doesn't appear to go away or improve, anything that seems kind of out of the normal or odd, painful intercourse. Those types of symptoms are definitely things that need to be evaluated and looked at either by your primary care doctor or your OBGYN.
And if diagnosed, what about treatments? Are there common and effective treatments available?
Yeah, so with regard to cervical cancer treatments, there are some patients who are candidates for surgical procedures to eradicate it and potentially cure. There are some patients who are candidates for a combination of chemotherapy and radiation therapy or systemic chemotherapy. And more recently, we have immunotherapies or targeted treatments to try to improve and eradicate the tumor.
Dr. Jeff James, thank you so much for spreading awareness today and telling us more about cervical cancer and all the treatments and vaccines available.
Thank you so much for the opportunity.
Now, along with our partners at Sarah Cannon Cancer Institute at Health One, the American Cancer Society, the Cancer Support Community, and the Colorado Cancer Coalition, we've put together some resources for you. If you have questions about cervical cancer, you can find it on the Your Health Matters page of thedenverchannel.com.